The Physicians Foundation basically was created to support physicians in their care of patients, to preserve the values of the profession, and to be there to help fund, without any strings attached, the kinds of efforts, initiatives, and support that docs will need to provide the best care to their patients. There's nothing else about it. It's pure, it's good. And so one of our awareness was that we really needed to help docs understand telemedicine. And when this initiative began, it was very, very minimally used. So when we look at some of the things we do, one of those is a physician's survey, and every 2 years we have a survey. Would have had one that came out now, in fact, but probably the questions we ask aren't quite as relevant as we were hoping they might be. So we may have to retool and adapt to what we know is changing the face of medicine. But nonetheless, we know that 4 years ago, less than 5% were using telemedicine. 2 years ago, maybe 18% in one way or another. Now, I wouldn't be surprised if over 90% of physicians have implemented some level of telemedicine, and probably 100% when now you include the phone calls that CMS has started to allow as a part of the telemedicine service platform. So yes, it is something that we think is hugely important, and when we started was not necessarily in the same context or let's say the same capacity that we're dealing with now. But the goal now is to help develop and devise the ways of implementing telemedicine in ways that give you a longitudinal perspective on your practice, to help work with specialty societies to develop disease-specific templates, to help scrutinize and understand what the attributes of the different telemedicine companies and platforms might be, to help and devise ways of implementing applications and other kinds of remote monitoring devices so that they can correlate with the kind of work you're doing to take care of your patients. In addition, to help support that implementation of telemedicine platforms into the EMR so that you have a seamless and non-redundant or parallel entry or experience, and allow that to really help us move forward in ways. So right now, we're reassessing literally on a daily basis what we can do that's going to be relevant to the implementation and the regular use of telemedicine for physician and physician practices to help take better care of their patients.